Okay, so when they're this angry, basically the goal of today's visit is to give you some immediate relief. So there probably was like a ball living under your skin, which kind of popped. I don't know if you ever felt something there before.
No, I didn't see anything erupt.
Okay, so I'm gonna basically put a little bit of numbing medicine in here.
Okay.
I'm gonna drain it. I'm gonna take a culture just to make sure there's no bacteria there.
Okay.
Then I'm gonna inject it with some cortisone.
Okay.
At some point down the road, like a few weeks from now, if there's anything that's remaining, we may need to kind of go back in and get after. There's like a wall generally to these cysts, but the skin's kind of too hot to address that at the moment. And a lot of times when it ruptures like this, the wall from all that inflammation just kind of like obliterates anyways. So part 2 is like may or may not have to happen.
Okay.
But in the meantime, we'll get you feeling better. You'll probably feel much more relief by like later today.
Great. I know as a kid when they would just inject right into the
Yes.
cyst, which is incredibly painful.
Here comes a little bit of numbing medicine. You're still gonna feel it a bit regardless, unfortunately, because these are very tender because they're so inflamed. You all right?
Yeah.
All right. So you're gonna feel some pressure. You shouldn't feel anything sharp or painful. Or sharp. It's gonna be a little bit painful. This is the pressure. It's thick. Sorry. You all right?
Yep.
You good?
I'll scream when I'm not.
I'm actually gonna put you on some antibiotics, just because there's a bunch of pus coming out of here, so it might actually just be an abscess.
Okay.
Sorry. Sorry.
No, sorry, Sam. And that's with the numbing.
Yeah. So the numbing actually doesn't help much with the actual tender. The skin is so tender coming all around to here.
Yeah.
As you've heard me say many times over, the most important part of any anti-aging skin regimen is using a proper sunscreen, namely one that's at least an SPF 30 and contains titanium or zinc or both. I couldn't be more excited to announce the launch of these 2 amazing Dr. Mudgil brand sunscreens. One is tinted, one is non-tinted, depending on what your preference is. I also have an amazing hydrating and moisturizing serum, which your skin is absolutely going to love. There's a link in the description below, which you can click to check out the products. You are going to love them as much as I do.
Sorry.
If you're feeling the music we used in this video, you can go to the description below and click on the link to the Doc's YouTube playlist.
I think it's pretty much all I could squeeze out of there.
Okay.
There's still some stuff in there which will just kind of like drain on its own. What you should do is when you take a hot shower, just let the hot water run over this area. And you can put some gentle pressure if you can reach it.
Okay.
I'm going to inject it with a little cortisone now, which is going to help with some of the inflammation. And then we'll put you on some antibiotics.
Okay.
I'll call you as the culture rolls in. It's probably, today's Monday, probably have it back by Wednesday-ish.
Okay.
But as soon as we have information, I just want to make sure that the antibiotic you're on is in fact the right one that you need to be on. And you also may not, if the culture comes back negative, I'm going to kind of taper you off of the antibiotic also,
Okay.
but we'll cross that bridge when we get to it.
Now, should I keep it covered with a Band-Aid?
We cover it with a Band-Aid now. It probably is going to ooze a little bit, so you might just want to keep it covered with a Band-Aid for the next couple of days.
Okay.
But when you take a shower, take the Band-Aid off and just let the water run over it. It'll feel good too, but it also gets the blood flowing and helps some of the stuff that's in there drain out.
Gotcha.
And I'm going to see you back in 2 weeks just to check on the area, and if we need to do anything, we can take care of it at that point.
Okay.
But any problems between now and then, you know where to find me.
Okay.
All right?
A heating pad or anything like that?
Yeah, I mean that's fine too. Any warm compress is good, but The main thing is when you're taking that shower, just let the hot
Yeah.
water run over it.
Right.
You can roll back over. All right, I'm here if you need me, man.
Okay.